Hi, welcome to Checking In with Amy. My name is Amy Goldberg, and I'm a registered nurse with Neighborhood PACE. PACE stands for Program of All-Inclusive Care for the Elderly. The elderly are people who are 55 years of age and older. We service the areas of East Boston, Chelsea, Revere, Winthrop, and Everett, Malden, Medford, Melrose, Stoneham, and Boston's North End. The goal of Neighborhood PACE is to keep people living in their homes in an active, safe, and independent manner. Today we're going to talk about anxiety. And my guest today is, I'm going to read this because it's long, is Karan Adalja, who is the candidate for Doctorate of Pharmacy from the Mass College of Pharmacy and Health Sciences. So welcome, Karan.
Thank you, Amy.
That was a mouthful. So let's today talk about what is anxiety.
So, Amy, anxiety is something everyone can relate to. Everyone has like mild anxiety throughout their life. It's just like the general worry that something bad's gonna happen. When you have like a little bit more prevalent anxiety, you can go talk to our staff at PACE who can help diagnose you and see if you need to seek further help. And you should definitely talk to your provider when this anxiety starts impacting your daily life more regularly.
So let's talk a little bit, because you're have your doctorate. You will be getting your doctorate of pharmacy. Let's talk a little bit about medications as well. Mm-hmm. But first, what's the difference between anxiety and anxiety disorder?
So, according to the Anxiety and Depression Association of America, the difference between anxiety and generalized anxiety disorder is that generalized anxiety disorder is characterized as having severe anxiety daily for at least 6 months. People with this condition usually have a racing mind, trouble sleeping, they feel breathless, sometimes nauseous, restless, have blurry vision, difficulty swallowing, feel like their heart is racing out of their chest, and they experience some trembling and shaking as well. We generally treat this condition with a medication called SSRIs.
So, here we go with our lingo, right? So what is, I've heard the term, obviously, so what is an SSRI and when is that used?
So SSRIs stand for serotonin reuptake inhibitors. Serotonin is a natural chemical found in our brain which helps regulate your mood. So when you have low levels of serotonin, you generally tend to have a bad mood, and when the levels are higher, you tend to have a good mood. So the way these drugs work is like, if you think of it as a seesaw, when there's a low level of serotonin, your mood's going to be bad, and when there's a high level, the other side's going to be up, and you're going to have a good sense of mood. But these drugs, they fall on the side even when you have low levels of serotonin, they fall and make it so that you have a good day and your mood's elevated and you feel happy and peppy. Generally, some of the drugs we use are Zoloft, Prozac, and Cymbalta.
Those are common ones that people would know.
Yes.
They're common names. So how does a provider choose which one of these SSRIs they might prescribe?
So a provider will choose an SSRI for you based on your personal characteristics. And though these drugs are not recommended for everyone, your doctor will decide based on your other medications, your level of function, and cognitive ability, whether these drugs are the right choice for you. Generally, the side effect profile is one of the main concerns. So the common side effects associated with these are drowsiness, anxiety, sexual side effects, dizziness, agitation, nervousness, headaches, or sedation. Though the majority of these side effects are not common in most people, if one of these side effects is like a red flag for you, generally bring it up with your doctor and he'll try to pick a medication with the lowest lowest side effect profile for the certain side effect. Generally, resolution of symptoms starts at 2 weeks, but it takes up to 8 weeks for full effect. So another drug your doctor might choose to use is buspirone. Brand name is Buspar. It has been shown in clinical studies to have a quicker onset of action than your SSRIs, it generally has more effectiveness at weeks 2 and 4 than an SSRI does, but at week 8, it has the same effectiveness as your SSRI. So it still takes the full 8 weeks to get full effect, but just another drug you could consider talking to your doctor about, as your SSRIs and your benzodiazepines are on a list called the Beers list, which are generally drugs you try to avoid in our elderly population, since it has they cause an increased fall risk and more side effects generally.
So you have to be careful when you take these medications.
Yes.
Very careful.
Yes.
I know, yeah. And I think people need to be aware of that before they start asking for meds or getting on them. They
People need to be
keep their doctor informed as to how they're managing on these medications.
Yeah, and they also have to be very wary of their side effect profiles of these medications and be sure to report any of these effects to their doctors, because it might require changing the medication or changing the dose.
Right. That sounds important to know. So now here I am with an anxiety disorder. You're going to put me on this medication, an SSRI, and maybe work 2 to 8 weeks, but now I'm anxious now. So what are we going to do in the meanwhile?
So if your doctor deems it appropriate, he'll start you on a medication called a benzodiazepine, which generally works within a couple hours to resolve the symptoms associated with anxiety. So the way a benzodiazepine works is by targeting the GABA receptor in your brain. The GABA receptor generally is responsible for slowing things down. So think of it like this. If a man is jumping off a cliff without anything, he's going to fall flat on the ground and he's going to get hurt. The way the benzodiazepines work is like it acts like it's a parachute to the guy jumping off the cliff, and it slowly and safely brings him to the ground. Some of the common benzodiazepines we use are Xanax, Ativan, and Restoril. It's important to remember that after your doctor has reached an effective dose of benzodiazepine that works for you, you don't need to increase the dose further, because the anti-anxiety effects of benzodiazepines don't change with dose increases. Only the side effects will get worse as you increase your dose.
So side effects. So with all these meds, obviously there are side effects. So let's talk about them.
As you can see on the screen, some of the short-term side effects commonly associated with benzodiazepines are dizziness, drowsiness, blurred vision, and sometimes depression. That's why they're used only short-term and not long-term, because the long-term side effects are a lot more severe, and these include sleep issues, addiction, cognitive impairment, mental disorders.
You said cognitive impairment. That would scare me. So is this cognitive impairment that could be a side effect, is that permanent?
So the cognitive impairment occurs after prolonged use of a benzodiazepine, which is considered to be over 160 days roughly. Generally, after 1 month of stopping the drug, you'll have some recovery, but it will never be 100% back to where you were at baseline before starting the drug.
So people should know all this prior to taking any of these medications.
Yes.
Yes, because this is a little scary, I think. So if I were on the benzos, how do you get off of it?
So the reason a person should not stop a benzodiazepine or an SSRI cold turkey is, think of it like this. If a kid's riding a bicycle and you put him straight on a two-wheeler, he's going to fall. If you put him on training wheels and slowly teach him to ride and then take the wheels off, he's going to be able to function. The same thing works with your body. After being on these benzos for such a long time, if you just take them off all the way, your body's just going to fall. It doesn't know how to work without it. But when you slowly wean the body off the drugs, it's like the kid with the training wheels. Your body gets used to not having the drug inside, and it learns to function without it.
What if, here's a good question for you, what if a patient decides that they want to have a glass of wine at night with their meal or whatever? How does this work in regard to all these medications we've been talking about?
So patients should completely try to avoid alcohol while on these medications, because combining alcohol with their SSRIs or their benzodiazepines has an increased sedatory effect, which increases their chance of falls and getting injured. So patients should avoid consuming alcohol while on these drugs.
And they should let their doctor know if they're having any alcohol.
If they're having alcohol or if they have like alcohol abuse issues, they should really make their doctor aware because this can cause very serious side effects and serious injury to the patients. And they should generally not be on these medications if that's the case.
I know the medication is used for certain people, not for everyone, that's for sure. So any other recommendations that you might have for people with anxiety?
There are a lot of non-pharmacological things people with anxiety can do, and they all deal with lowering your stress levels. You can meditate, do yoga, exercise, counseling services that are offered by PACE, even try acupuncture. And remember, most of these services, if not all, are offered by PACE. And if you ever have any questions, you can always go talk to your local pharmacist or provider.
So I thank you, Karan, and I wish you all the best as you finish your years of training. So many, huh?
Yep.
Yeah, I'm proud of you. So you're at the end of your 6th year.
Yes, I am.
Yeah, and that's wonderful. So let me tell you a little bit more about PACE in regard to counseling. We have, as part of our PACE program, 9 social workers. We have 2 psychiatric clinical nurse specialists, and they are supervised by a psychiatrist from the East Boston Neighborhood Health Center. Psychiatry is part of Neighborhood PACE, and this can be provided by the PACE program, the East Boston Neighborhood Health Center provider, North Suffolk Mental Health, Boston Medical Center, and even a Mass General provider. So along with counseling and getting groups that meet and acupuncture that Karan mentioned, we have all kinds of various treatments that are very inclusive to help you through these difficult times. If you or anyone that you know might need further help or more information about Neighborhood PACE, please feel free to call us at 617-568-6377. And until we meet again, stay well. Thank you.